answer the most frequently asked questions about hair transplant surgery. What is hair transplant surgery? Hair transplant is a procedure where hair roots are removed from the back of the scalp and they are implanted to the front where the scalp is bald. It is as simple as that. So it is done in two ways. The older method is called strip method, where skin also used to be removed and there used to be stitches. Now, past 8 years, we are doing only FUE technique. That is, we remove only roots under the microscope using very specialized advanced machinery, and we implant it to the front where it is bald. The next question is, can both men and women get hair transplant? Yes. Both men and women can get hair transplant done, but indications for doing a hair transplant in ladies are very less. Most of them, 90% of the hair transplants we do in our center are for men, and it's for male pattern baldness, where front becomes empty, whereas the back of the scalp, that is occipital region, still has lot of hair. Third question is, what is the success rate? Success rate of hair transplant in a specialized center like ours with advanced technology and very trained, skilled team is almost 97%. In a year, we do around 100 hair transplants, only 3 will be unhappy. 97% of patients or clients are really happy about the hair growth and the way hair transplant results are. Will hair transplant really work? Yes. As I said in the earlier answer, hair transplant works almost in 97%, and it's a very successful procedure in today's modern aesthetic surgery. Is hair transplant worth it? Yes, hair transplant is definitely worth. Whereas other treatments that are there, medication and platelet-rich plasma, do not ensure this high rate of success, where hair transplant has very high success rates compared to other modalities, and definitely worth it if it is done for the right indications, in the right place, by the right team, by the right doctor. Next question is, after how many days can I notice hair growth? This is a very important question. After we do hair transplant, few of them start growing in as early as 2 weeks. Most of the scabs will fall off, and you can notice hair growth only at the end of 2nd month and 3rd month. It keeps on growing for almost 6 to 7 months, and sometimes even a year after hair transplant. Next question is, what is the cost of hair transplant? This is a very variable thing. Hair transplant usually is charged depending upon number of follicles that are transferred. Normally, in a scientific operation theatre and by a doctor who really understands hair transplant, normal number of hair follicles that are transferred are anywhere between 2,500 to 3,000 units, which will amount to something like 4,000 to 5,000 strands. Doing more than this is not a very optimal thing, because the dose of local anesthesia will increase. There is what is called grafts being outside the body time, that also increases. So for optimal results, we should do something like 2,500 to 3,000 follicular units in per session. And you should, why you have to pay for a hair transplant by a qualified surgeon is for your own safety. It has to be done by a doctor who is trained, preferably in microsurgery and in hair transplant surgery. Especially plastic surgeons are the best trained for this, and it has to be done in an operation theatre like this, where there is laminar flow and a modular operation theatre, which will be reducing your infection rates to almost 0. And there should be all safety net, and there should be anesthesia backup and emergency medication. All that should be there. This is definitely not a procedure to be done in a mall or in a modified kitchen of a small clinic. This has to be done properly. This has to be done by the proper team. Then it's the right procedure. So make sure that you are paying for the right hair transplant, the right amount of money. How long is the history procedure? Normally we take around anywhere between 4 to 6 hours for a session of hair transplantation. There will be tea and lunch breaks in between, so that you feel really comfortable and the procedure is not strenuous on you. And how many sittings is HD? As I said earlier, in each session we can do around 2,500 to 3,000 grafts transplant. So depending upon the requirement, say a 50 square centimeter area of baldness will need around 2,500 units roughly, and if the area of baldness is more, it is wiser to do in a second session, so that your recovery is fast, results are good, and you don't get strained. All the best.